Hey guys, so as promised, we're going to talk about mind over mood. First thing I want to talk about is the little story I was going to tell you guys earlier. When I was in the outpatient treatment, basically where you go to the hospital as an outpatient as part of supplementary care for when you were hospitalized during your crisis, they gave us, they basically taught us and recommended this book, Mind Over Mood by Dennis Grabner, I think. It's very well known. Over 100 million copies were sold, and it's very, very popular. It basically explains cognitive behavioral therapy, the SUD scale, basically what I'm doing, exposure. It explains all this, talk therapy. So that's what they taught us in that, and I learned a little bit from it. Not a lot. That's why I want to learn more with you guys. I have the Wikipedia page for homework and psychotherapy open. I just want to say a couple things here. Psychotherapy is basically talk therapy, where you go to a therapist and just talk with about your problems, or anybody. They have to be trained though. They have to be trained, so that's why I say therapist. Second thing I want to say is that homework was something. Homework in psychotherapy was something that was first mentioned to me by my first psychotherapist. He mentioned workbooks similar to Mind Over Mood, such as the OCD workbook, the social anxiety workbook, and basically those posited these same type of ideas of going home after your therapist visit and writing down your thoughts, writing down your feelings, and seeing how they interconnect with your behaviors to kind of cull out the deeper meanings of why you have these, anxious thoughts and behaviors and ruminations. So I didn't take it seriously then. Fast forward to 12 years later, and here I am taking it seriously. So this is just a warning to people. Take it seriously when it's first exposed to you, and don't think, therapy's not real, or I'm not as sick as that, I don't need to take it seriously, or you know what I mean? When it's better safe than sorry. Just take it seriously and you won't have to worry. So let's go through this. Homework in psychotherapy is sometimes assigned to patients as part of their treatment. In this context, homework assignments are introduced to practice skills taught in therapy, encourage patients to apply the skills they learned in therapy in real life situations, and to improve on specific problems encountered in treatment. Example, a patient with deficits in social skills may learn and rehearse proper social skills in one treatment session, then be asked to complete homework assignments before the next session that apply those newly learned skills. Example, going to a social engagement or greeting 5 people each day. Homework is most often used in cognitive behavioral therapy, CBT, for the treatment of mood and anxiety disorders, although other theoretical frameworks may also incorporate homework. Some of the types of homework used in CBT include thought records and behavioral experiments. Patients using thought records are instructed to write down negative cognitions on the thought record form and weigh the evidence both for and against the negative thoughts, with the goal being to come up with new balanced thoughts in the process. That's what we talked about yesterday. Behavioral experiments are used as homework to help patients test out thoughts and beliefs directly. Studies have shown that homework completion and accuracy predict favorable outcomes in psychotherapy and may help patients stay in remission. However, some patients are concerned that assigning homework makes therapy too formal and reduces the impact of the individual sessions. I know I can consider this kind of like homework for my latest therapist. He basically said he wants me to eat more, so I consider this kind of like therapy for that. Homework for him. Another thing I want to say is during the slideshow, he mentioned how anxiety disorders are common yet serious, and that's very important. Just because something is common, this is something I learned. Just because something is common doesn't necessarily mean it's okay. Like just because you're common, or common has a good connotation to it, and not necessarily in mental health because it's so common. It's becoming serious. Okay. Approaches. Boring. Let's talk about thought records. Actually, what we were doing, right? We did a thought record yesterday about my choking phobia, right? So, thought records or thought diaries, that's what the girls call them. I'm kidding. Are among the most commonly used cognitive assignments in CBT. They allow patients in various situations to closely examine quote-unquote hot thoughts and cognitive distortions, and after having done so, arrive at a newly synthesized alternative thought that more closely fits the situation. Many thought records accomplish this task by having patients list out in order the situation they are in, the emotions they are feeling, and with what intensity those emotions are felt, what thoughts they're having, and what the quote-unquote hot thought is, evidence for the hot thought, evidence against the quote-unquote hot thought, balance alternative thoughts, and the emotions they feel after having completed the thought record and the intensity of those emotions. So these videos are basically thought records as well. He basically, in the Wikipedia article, that's like the most formal way of doing a thought record. If you want to have a more less formal and equally effective way, check out my last video about exposure and depression. shows you how to map out thought records. They're much easier. So, hold on a second. Let me just smoke this. So that was an example of someone doing a thought record. And this is the most complex one. I'm going to show you guys, if you guys want to do the complex ones. I mean, some people work differently with complex ones. I was first taught the complex ones. I didn't understand them. I'm going to put them here for posterity. If people do want to learn from them, I recommend the easier ones, which is just basically, as I mentioned in the last video, very simple, very easy. Doesn't require a lot of knowledge of psychology. You just need paper and pen, and a mind. This is a bit more complicated. Let's take a look though. So Jane has social anxiety disorder and was just told at work that she would be giving a presentation in front of an audience of 200 people the following week. This produces a large amount of anxiety for Jane, and she starts filling out a thought record to try to calm herself down. To begin, she fills in the column about the situation she is in with, "I was told that I was going to give a speech in front of a large audience next week." In the next column, Jane writes what emotions she is feeling and with what intensity she is feeling them. Anxious, 100. Afraid, 90. Sad, 40. She then starts identifying some thoughts that immediately ran through her head when she heard that she would be giving the presentation. These are known as automatic negative thoughts. "Oh no, I'm going to mess up and choke. Everyone will laugh at me. My boss will fire me. I will never be able to hold a job at this rate. I'm worthless and a failure." Jane identifies "I'm worthless and a failure" as the hot thought, the thought that invokes the greatest amount of negative emotion in her situation. In fact, people have anxiety, social anxiety. This is a thought you do have from time to time. "I'm worthless and I'm a failure." Very common thought. After that, Jane starts writing in the next column the pieces of evidence that support the hot thought. "I've done terribly on presentation in the past. I remember one time in high school when I had to give a speech in front of my class and ended up crying in front of everyone instead. I got a C on that speech and barely scraped by in the class. My high school friends and I don't talk as much anymore. They must be starting to get sick of me too. My coworkers don't try to talk to me either." Jane jots down in the next column pieces of evidence against her hot thought. For example, "I think my boss might have meant well when he gave me this presentation assignment. I did one of these presentations on a smaller scale last week, and I think I did just fine. Almost everyone who was there even came up to me and told me so afterwards. I think that those audience members do care about me and would be willing to support me if I asked. Also, I'm filling out this thought record just like my therapist told me to. I think that's what she would have wanted from me." And so in the next column, Jane writes down her alternative thought. The presentation ahead may be scary and making me feel anxious, but I think I can handle it as long as I know that there are people who support me." After that, Jane writes the emotions she is now feeling and their intensities. Anxious, 50. Afraid, 40. Sad, 10. Relieved, 50. So as you can see, the numbers went down. In the beginning, she had anxious 100, went down to 50. Afraid, 90, went down to 50. Sad, 40, went down to 10. And something increased. A positive thought, relieved, went to 50. So let's take a look at the efficacy. Basically, how effective is this? Both the quality and quantity of thought records completed during therapy have been found to be predictive of treatment outcomes for patients with depression and/or anxiety disorder. That means disorders. Furthermore, Reese, McAvoy, and Nathan, 2005, found that accuracy ratings of patients' thought records mid-treatment was positively correlated with post-treatment outcomes, and that doing homework in CBT was overall preferable to not doing homework in CBT. Completing thought records accurately may also be indicative of overall skill gain in treatment. Do you understand? To be able to understand, for example, the complex thought records means that you're gaining more skills, you're learning more about therapy. It doesn't mean you're, that you can't do the simple records. You can still do. It's just when you do the more complex one, it allows you to understand things like hot thoughts and thinking errors that we have. For example, catastrophizing. You thinking, there's on Reddit, just yesterday, what happened with Trump. He apparently, killed the Iranian intelligence minister or something in an airstrike. And everyone's thinking it's going to be World War III. That's catastrophizing. You got to weigh the evidence for and against, right? That's what you need to be doing. There's other ones like making mountains into molehills, right? Basically, that's catastrophizing. So there's other ones like part whole thinking, not seeing the forest for the trees, right? Or not, you know what I mean? Just part whole thinking, looking at you're thinking, oh, I'm walking. You drive down a street and you see, you've never seen sheep before, and you see 10 white sheep, and you assume all sheep are white. I don't know. I've never seen every sheep. Are they all white? Common knowledge is that they're white. I'm sure we can find sheep that are not white, though. A better example is, for example, you go into Canada in December. You come here from like a different country and you walk in here, like, oh, it's so cold. So you assume Canada's always cold. You're not looking at the fact that it gets warmer in summer. That's part whole thinking. And there's other type of negative thinking errors. I want to get into them one day with another video. Let's just go more into this. Basically, they're saying it works. The thought records work. And it says here, two other therapists, Neimer and Fiexis, who wrote a study in 1990, found that patients with depression who completed thought records accurately were less likely to relapse 6 months after treatment termination. The researchers hypothesized that this was because the patients who completed thought records accurately had acquired the skills taught in CBT, that these skills served as valuable coping strategies when the patients were faced with future stressors and needed to act as their own therapist, which is exactly what I'm doing right now. I can't afford therapy right now, so I'm acting as my own therapist. Okay, so this is the part of the video I would implore anyone under the age of, the legal limit of alcohol or marijuana consumption to stop watching, as I'm going to be smoking marijuana now. So, give me a second. I gotta open this box. Alright, let's see, move on here. Behavioral experiments. Efficiency, problems and uncertainties, future directions. So, I think this is as much as I want to talk about. I mean, let's see if I have Wi-Fi out here, because if I do, I could definitely look into more things. Like, what is cognitive behavioral therapy? Looks like somehow I have some Wi-Fi here. Oh my goodness, it's working. All right, guys, we're going to learn about cognitive behavioral therapy, the end-all be-all video. This is going to be the video that's probably going to be one of the most important videos you'll ever watch on my channel. It's called Cognitive Behavioral Therapy, CBT. I've mentioned it many, many times. First, let me tell you what I know about it. Then I'll tell you what Wikipedia tells us about it. I first heard the term cognitive behavioral therapy, or CBT, I want to say during my second therapist. Perhaps my first therapist mentioned it. It was my second therapist, though, when I was really, really facing loneliness, alienation, and to a certain extent starvation. It was just a chore to eat. That I saw this therapist. I was praying a lot. I was doing a lot of, Islamic things. Unfortunately, though, things happen, though, that you just can't control. Like, my parents divorced, and, my mom, my mom, well, I call her my mom, my stepmom, she came in the house without any warning, as per direction from her husband, my father, and it was just really, really troubling for me. Like, literally, I had very little warning that she was coming over. I had major panic attacks, major panic attacks. It only increased my anxiety, never really helped me get better. And so I was landing to another therapist who told me about cognitive behavioral therapy. I didn't know what it was, and I got too scared to basically stay and find out. I stopped going after my third session. I learned later what cognitive behavioral therapy kind of is facing your fears. It's about facing your fears, allowing them to go high, right? This is what my first therapist told me. They go high, and then they won't get as high. The best way I've heard it described is, hold on, let me just smoke this joint real quick. The best way I've heard it described is, evolution. In evolution, you have certain traits that allow us to survive. For example, we have, good eyesight and good hearing. So we know predators are nearby, and right? We have intelligence with our brain. We have our opposable thumb. Well, one of the things we also have is adrenaline. It's a chemical in our body that's released when we're scared. For example, NASCAR athletes have a lot of adrenaline pumping through their brains when they're through their veins, through their body when they're driving, race cars. Thing is, that adrenaline tells us that you need to be scared. It's a natural evolutionary tool, just like the opposable thumb, or the ability to walk upright, or bigger brains, that help us become the most dominant species on the planet. Adrenaline produces anxiety symptoms. One of the things of anxiety is that you have an increase of adrenaline when you feel anxious. So the human body will trick itself into believing it's anxious. What I've heard, what exposure therapy is, what cognitive behavioral therapy is, what facing your fears is allowing the adrenaline to go into your body like you're a NASCAR driver, right? And allowing it to get so high that you're going to feel you're going to die. Because when a NASCAR driver is very, very in a race, he may feel he's going to die sometimes in a car crash or going on a tight turn, passing a guy, finish line. And the whole purpose of cognitive behavioral therapy and exposure therapy is to allow the patient to be in that situation safely. So no, you're not in a NASCAR race. No. The bees, we'll put them over there in a safe place. The food will make it very, very soft, right? Very, very chewy. You'll have a lot of water. Don't worry, you'll breathe, meditate, right? And then the patient gets convinced that the situation that they're fearing is not the real reason why they should be scared. They should be scared, for example, for if they were to riding a NASCAR rink, right? Or on an airplane and it's crashing, or if there's a robber robbing you. Those are normal things to be scared for. So that's the whole purpose of cognitive behavioral therapy. And she said it best, that human beings would not have been able to survive on this planet. The human body would not allow adrenaline to get this high for this long a period of time, right? It's impossible. The human body can't let that happen, because then, it would be a maladaptive evolutionary coping mechanism, right? The human body won't allow it, because we've been evolved to be the most dominant species. It would be different if we were like monkeys. Then we could say, yeah, we're never going to get past anxiety. That's just something we haven't evolved beyond. We can learn to evolve beyond anxiety through behavior. And that's exposure therapy. That's cognitive behavioral therapy. That's what I learned about it. Now, we're going to hear what the scientists say. Okay. There's a lot of big words here that I kind of know, kind of don't know. So I'll try my best here. Cognitive behavioral therapy, CBT, is a psychosocial intervention that aims to improve mental health. Psychosocial intervention is an intervention with therapists as well as like your family. It's like an intervention of like behavioral as well as medication. Okay? CBT focuses on challenging and changing unhelpful cognitive distortions, example, thoughts, beliefs, and attitudes, and behaviors, improving emotional regulation and the development of personal coping strategies that target solving current problems. Originally, it was designed to treat depression, but its uses have been expanded to include treatment of a number of mental health conditions, including anxiety. CBT includes a number of cognitive or behavioral psychotherapies that treat defined pathologies using evidence-based techniques and strategies. That's the first thing they want to do. This is evidence-based. How much evidence do you have that you're going to choke? How much evidence do you have that someone's going to make fun of you? How much evidence do you have that you're going to get stung by a bee or bit by a dog? And then weigh that evidence and then proceed accordingly. Don't proceed without weighing the evidence. Okay? I just have to spit here. I do that a lot, and I also need to light up again. All right. Oh, I am still here. Just dropped it. CBT is based on the combination of the basic principles from behavioral and cognitive psychology. So, I don't know what any of that means, so I'm just going to keep reading. It is different from historical approaches to psychotherapy, such as psychoanalytical approach, where the therapist looks for the unconscious meaning behind the behaviors and then formulates a diagnosis. Instead, CBT is a quote-unquote problem-focused and quote-unquote action-oriented form of therapy, meaning it is used to treat specific problems related to a diagnosed mental disorder. The therapist's role is to assist the client in finding and practicing effective strategies to address the identified goals and decrease symptoms of the disorder. CBT is based on the belief that thought distortions and maladaptive behaviors play a role in the development and maintenance of psychological disorders, and that symptoms and associated distress can be reduced by teaching new information processing skills and coping mechanisms. When compared to psychoactive medications, review studies have found CBT alone to be as effective for treating less severe forms of depression, and anxiety, post-traumatic stress disorder, PTSD, tics, substance abuse, eating disorder, and borderline personality disorder. These aren't tics like the insects. These are tics for people who have Tourette's. It is often recommended in combination with medications for treating other conditions such as severe obsessive compulsive disorder, OCD, and major depressive disorder, opiate use disorder, bipolar disorder, and psychotic disorder. Citation needed on that one. In addition, CBT is recommended as the first-line treatment for the majority of psychological disorders in children and adolescents, including aggression and conduct disorder. Researchers have found that other bona fide therapeutic interventions were equally effective for certain conditions in adults. Along with interpersonal psychotherapy, IPT, CBT is recommended in treatment guidelines as a psychosocial treatment of choice. And CBT and IBT are the only psychosocial interventions that psychiatry residents are mandated to be trained in. So let's just look through the quick table of contents as to how they're going to, organize this. Start with description, cognitive distortions, skills, phases in therapy, delivery protocols, and related techniques. Then there's another section, medical uses, depression, anxiety disorders, bipolar disorder, psychosis, schizophrenia. With older adults, prevention of mental illness, pathological and problem gambling, smoking cessation, substance abuse disorders, eating disorders, internet addiction, prevention of occupational stress. Then history, philosophical roots, behavior therapy roots, cognitive therapy roots, behavior and cognitive therapy merge, third wave CBT. And there's a fourth section, method of access, therapist, computerized or internet delivered, smartphone app delivered, reading self-help materials, group educational course. And there's types, BCBT, cognitive emotional behavior therapy, structured cognitive behavior training, moral reconnotation therapy, stress inoculation training, mindfulness-based cognitive behavioral hypnotherapy, unified protocol. And there's criticisms of mostly everything on Wikipedia. Relative effectiveness, declining effectiveness, high dropout rates, philosophical concerns with CBT methods, side effects, socio-political concerns, and there's society and culture. I actually want to start with the history for some random reason, and just do my own way of learning. Although I know probably because I want to actually not do that. Like that's what I want to do. Although I know it's not the most professional thing to do because Wikipedia obviously arranged it in a way. And although I did do that with the anxiety videos, and it didn't seem like they're that big of a deal to me. You know what, guys? This is getting longer than I wanted it to. As much as I love talking for like an hour, I wasn't really planning on making this a really, really big video. Like I talked what I wanted to talk about. So what I know about exposure therapy, and obviously my exposure, and getting into like what I know, and now basically getting the meat into the cognitive behavioral therapy, the meat of what is therapy. As I said before, the meat of therapy is exposure therapy, and exposure therapy is a type of cognitive behavioral therapy. It's an umbrella, as far as I know. I could be wrong. That's what I'm learning. So I want to start tomorrow, basically getting to cognitive behavioral therapy, because I think as much as I want to get into today, this is like a good 50-minute video. I mean, there's so many different things I can talk about. You know, I'm going everywhere with it. So what I'm probably going to do is perhaps read through it, perhaps not, perhaps read sections of it, and come back tomorrow and be like, all right, we're going to do an exposure, then we're going to go straight into cognitive behavioral therapy. And in terms of video, what we're going to do is more than likely, we're going to do videos on cognitive behavioral therapy. Actually, no, we'll still do the video on mind over mood, because that's kind of, you know, it's related. Mind over mood is a nice way of saying what cognitive behavioral therapy wants you to learn. I'll end with this story. It's an anecdote. I was at house one time, and it was Easter. It was my ex-boyfriend at the time. And I hated lasagna. For the love of God, I wouldn't eat lasagna. I never did, never will. Up until that day, I told myself, never gonna eat lasagna in my life. You could give me $1 million, I would spit in your face. Stop wasting my time. Hate lasagna. It's Easter. Guess what they bring out? Lasagna. And they don't know about my food rigidity and all of this, and I haven't really, you know, explained it to them, because I'm dealing with being gay and having to deal with it just never came up. You know, it's just, they were still getting to know me. It's not like one of those things I just say, oh, here's one of my problems, by the way. I don't eat this and that. It would come off as too, you know, like, there's no point in saying that. You want to say the good things about you first. So they gave me a slice, big old slice, and here I am. Their family's there, and their family's family is there. It's a whole bunch of people. It's Easter. Everyone's there, having a great time. And I'm like, I need to take a bite. I cannot not take a bite. I have to take at least one bite, because you need to express your thanks to the cook. And you can't do that until you taste it. And there's no way of saying, well, by the way, I have a sort of rare, sort of picky eaterness. That's not going to go down well, you know. So I took a bite, and I said, mind over matter. Took the fork, bit down the lasagna. The cheese broke as the plastic fork dug in my mouth, chewing it for about 2 seconds. Complete gag. That's how I was thinking. Here's how it looked. And then I swallowed the tiniest bit of lasagna for the first time. And I want to say 20 years. In spite of everything, in spite of my deeply held ingrained beliefs that I don't eat certain foods, because I don't like, you've seen me gag on certain foods. That's the type of person I am. People have said it's like food neophobia, it's autism. What the point? I don't care at this point. I'm happy enough with it. If I want to work on it, I'll work on it. The story I'm trying to say, though, is that's what this is. Mind over mood. It's mind over matter. You know what I mean? It's mind. Think about that. It's mind over matter, man. It really is. Because you want to have a good impression. You want everyone around you to be happy and no conflicts. So you do it at the expense of your own mind. And that's what this therapy is. You can do that. Again, the lasagna is your problem, right? And you eating it is the process of, you know, mind over mood. We can do it. So with that positive note, I'm going to end this video. Hope you enjoyed it. Hope you guys had a great time enjoying these videos. So it was a 0. It went to it was a 1 and it went to a 0. I feel very happy. Everything's great. And with that, guys, I have a video tomorrow. And we're going to stay with it.